Dr. Lucille is a nationally recognized naturopathic physician. She's a consultant, an educator, and a television host. Her TV show, Mythifying with Dr. Holly, airs on Z Living Network. She is a registered nurse with postgraduate training in holistic nursing, and then she went back to medical school and obtained her naturopathic medicine degree from the Southwest College of Naturopathic Medicine. She is the past president of the California Naturopathic Doctors Association. And Dr. Lucille has a private practice in Los Angeles. I don't know where she finds time because she is such a busy woman. But her private practice is called Healing from Within Healthcare, and it focuses on comprehensive naturopathic medicine and highly individualized care and protocols to get people back to their optimal state of wellness. I have heard her speak before, and I believe you are in for a treat because she is not only informative, she is very entertaining. So without further ado, I would like to introduce to you Dr. Holly Lucille. Welcome, Dr. Holly.
Thank you, Cheryl, so much, and everybody out there. I've basically learned everything that I know from Cheryl, so that's just, everybody needs to know that. I do want to thank Terry Talks and the whole team because I do these often, but they're never executed as well as they are when I do them for Terry Talks Nutrition, and so I really appreciate being a part of such a high standard and just high quality product, that's for sure. And thank you so much for joining us. Yeah, Breast Cancer Answers. You know, one of the things that I think perhaps is the answer for what we have going on today is just the ability to ask more questions, quite honestly. You know, I think that cancer and breast cancer, certainly there's a lot of awareness this time of the year in this particular month, but I think there should be awareness across the board because there are many people that actually end up having this diagnosis, and it can be completely devastating for folks. And so, like I said, I think some of the answers lies in the ability for us to just ask better questions and more questions, because a lot of people, when faced with this diagnosis, perhaps I know that there's a lot of fear. I certainly know this from family, friends, myself, having been diagnosed with cancer, not breast cancer, skin cancer, but I have a sort of it's that C word that gets people's attention. Sometimes they go right to their primary care doctor, and it's down the sort of protocol of conventional Western medicine. And, you know, I've always said, if you've heard me talk before, I think there is value in all systems of medicine, conventional Western reductionistic medicine for sure, but there's also other systems of medicine. I'm a naturopathic doctor. I look at things a little bit more comprehensively, wanting to identify and treat the cause and treat the whole person and practice individualized medicine and understand multiple influences to the clinical condition that is showing up in front of me, whether it be cancer or anything else, our environment, our history, our diet, all of those things. And so I just think it's really important that these days, and what I'm seeing in the research, that we're able to ask these better questions, look outside the box. Certainly conventional cancer treatments like chemotherapy and radiation are helpful and they're life-saving. They can also be devastating as far as side effects are concerned, and there are alternatives as well. And so I hope to just tap on some of these things. And my main goal for this particular topic is to find the answers in the better questions and the more questions that we're asking, and also introduce you to just a few of the natural interventions that we can use for this devastating diagnosis, okay? All right. So, you know, I guess I want to ask, like, what exactly is cancer? I know, like I said, it's the C word. It's very connotated, I believe. There's a lot of fear associated with it. There's a lot of hype, I think, especially around the month of October associated with it. But I think if we just get down to it on a cellular level, it's really important to understand that, first of all, and you've probably heard this, that our cells are dividing, right, all the time. But cancer is really defined as sort of an uncontrolled division of abnormal cells. And one of the things that I think is important to note is that we have a pretty good system in place to actually mitigate some cell division or abnormal cells. We've got our immune system. There comes a point in time sometimes, though, I would say during this process from going from normal cells, as you see right there, to sort of a hyperplasia, that's that sort of division, that uncontrolled division, into a polyp, a cancerous tumor, and then as it spreads into a metastatic cancer, that our immune system starts to sort of get defunct, or it is otherwise occupied, or it loses the battle as far as what's going on with the cell division. But for the most part, we do have this immune system that is intact, and it's kind of watching out each and every day, taking care of sort of foreign objects that get into our body. It's through the detoxification process. Our immune system is looking for these things all the time. And we do have a check and balance system, but sometimes it can get out of balance, and then those cells start to proliferate, and we end up with a cancerous tumor, okay? When that happens, one of the things that we're going to talk about later on in the presentation, your brain is pretty smart, it is, and it says, I've got new tissue growing down there. Well, I guess it's we got to get blood supply to it. So something called angiogenesis happens. Angio, that's new, genesis, or angio is vessels. We've got genesis, new, so new vessels, new blood vessels sort of going to the tumor, and then that starts to kind of feed it, and then we get into a little bit of trouble. But we're going to talk about angiogenesis and how we can pretty much prevent some of that. So I want to talk about just a couple things that you might not know when it comes to breast cancer. So first of all, this is a pretty startling stat. A new case of breast cancer is diagnosed every 2 minutes. And I see this in my practice all the time. I'm going to introduce you at the end of the presentation to a group of folks. I do not specialize in cancer. For a long time here in California, we had a bill in place that unless you were an oncologist, you couldn't treat. It was illegal to treat anybody with cancer. But there's a group of naturopathic doctors, and there's an organization called ONC-ANP, which is Oncology ANP. These are naturopathic specialists, and I'll give you that referral. But I do see many of my patients get diagnosed with cancer. I can name 4 breast cancer in the last 2 weeks, actually. So this is still, despite all the awareness, despite all of the walks and the awareness during this month particularly, and the fundraising, this is still a devastating diagnosis that happens all the time. And I think that is something that I want to draw attention to, because as a naturopathic doctor, prevention is secure. We want to talk about that, and we want to talk about more understanding the influences. A couple things as well that I want you to know is breasts have these tails. The tissue extends into your armpit, sort of in the shape of a teardrop. So if you're doing self-breast examinations, and I do advocate that, that's very, very important, because many of my patients will actually find a lump or find, sort of those dividing cells that have been growing on their own, and they go in and get it checked. And so I advocate at least once a month at the same time of the month, especially if you're cycling. And what I like folks to do is to get up in there all the way up into your armpit, okay? That's very important. Also, take a look at the nipple. Nipples can signal problems with the breast. Any persistent itching also. A small lump that's like a bug bite on the breast you want to look out for. Any skin puckering on the breast, okay, that's like an indentation that appears if you raise your arms over your head, okay? And then if there's, as far as the nipple health, if there's discharge particularly on one side, or if it's bloody, if there's any flaking of the nipple or change in color, those are things where you just want to kind of go, get curious, all right, and definitely get that checked out, okay? Because I think that those are signs that something might be developing there, and those are things that I just really want you to know. So once again, identify and treat the cause. I think it's so important because, as Cheryl said, my practice really focuses on the individual. Everybody is so special and so biologically just different. They are. I mean, we've got some similarities as human beings, we do. But boy, oh boy, when it comes right down to it, patient-centered and individualized medicine, I think, gets the most results because we get to take in all the specific characteristics of somebody's life, of their thoughts, of their genes, of their environment, of their diet, of their exposures. Everybody is so different, and it's so important to take those up. One of the things that these are some of the influencing factors when it comes to cells being able to divide uncontrollably. Okay, so first of all, having one first-degree family member, okay, for your mother, for example, doubles your risk of breast cancer. Having 2 or more first-degree relatives, so think about mother and sister, increases your risk by 3 to 4 times. I will tell you here that the biggest risk factor for getting cancer is already having had cancer, okay? So that's a risk factor across the board. Having the BRCA1 or 2 genetic mutation is associated with up to an 85% risk of breast cancer. Some other stats, women exposed to certain toxins before a first pregnancy have a 40% increased risk of breast cancer. Smoking before a first pregnancy increases breast cancer by a risk of 20%. Women eating high levels of processed sugar have a 27% increased risk of breast cancer. Beginning menstruation before the age of 12, which, oh my dear, I see this all the time. Young girls, we're starting their periods 2 years earlier than we were 20 years ago, even more. But this increases the risk of breast cancer by 30%. And what I tend to see in my practice, honestly, I see because I have the privilege and the honor to have time to take time to go through a very, very in-depth consultation with my patients. So I get to know a lot about them. Nutritional deficiencies, exposure to environmental toxins, inflammation imbalances. We have inflammation that is healthy in our body, but when that gets out of balance and you've got inflammation that's sparking throughout the tissues, that certainly is a contributing factor. Estrogen stimulation, we get that not only from things that we're taking, whether it's oral contraceptives or other forms of exogenous, outside our bodies, estrogens, our own poorly detoxified estrogens. Our bodies look at estrogen sort of like a toxin, and our liver has to process that. That can be a stimulation for breast cancer. And I see this as a resultant breakdown in genetic integrity because, we can't change our genes. We can't change our DNA, but here's what we can change. And there's a huge field of epigenetics and then therefore nutrigenomics. So we can change our phenotypic expression, so how do our genes kind of express themselves. And that's really important because I see this breakdown in genetic integrity and also a breakdown in immune surveillance. And that's what leads to sort of these cells kind of getting out of control. The most recent woman in my practice that was diagnosed with breast cancer, I basically work with her. I'm sort of her quarterback. She comes in once a year because she has insurance. I believe she's on Medicare, and she kind of gets her yearly things and then basically floats them all to me, and we have this huddle. She stopped doing mammograms about 5-6 years ago, and she's been doing thermograms, and her thermogram picked something up. And I said, you know what, this needs to be, due diligence. We've got to follow this through. Did an ultrasound, and there was something that did a fine needle biopsy. And then she's going to have a lumpectomy, but she's got sort of, I hate to say garden variety, but she has, we're doing some genetic testing, of course, on the tissue itself and sort of understanding the story of the tumor. But, one of the things that I think was pretty startling, like I saw her about, I would say 6 weeks ago, and then we started to just go down the path of more investigation. And then she followed up just this past week, and she had lost about 16 pounds. And she wasn't losing weight because of stress, because it's obviously very stressful to start making some of these decisions and understand that you have this diagnosis. But she lost weight because she stopped eating all the sugar that she was eating. And she's otherwise pretty healthy, but she had to become really clear with herself, because I think she thought she was pretty healthy, but her intake of frozen yogurt every night and a cookie here and a cookie there just kind of in the last couple of years got out of control. And so a lot of times we can look at something like this as an opportunity to say, okay, something has gone completely out of balance in my body, right, obviously, and let's take a look and see what we can pull back under our control and get things back into balance. And so we've got to be able to identify and treat the cause and at least identify these multiple sort of contributing factors, because that's how we get to the root, right? That's how we get to the root. So a little bit more on breast cancer and the hormone connection. First of all, 70% of breast cancers are estrogen receptor positive, okay? And these are things that we want to know about the cancers once it's diagnosed. Up to 20% of breast cancers are actually estrogen receptor negative. But breast cancer cells can also have receptors for progesterone and the human epidermal growth factor receptor, otherwise known as HER2, okay? So a negative test for all three of these receptors is called triple-negative breast cancer. A couple things to know here: hormone receptor negative cancers will not respond to drugs like tamoxifen. Okay, so often the recommendation there is straight chemotherapy. Estrogen receptor positive cancers are usually treated with something as a selective estrogen receptor modifier like tamoxifen, but here's the thing: only 50% of all breast cancers fail to respond to tamoxifen. And most that do respond will eventually develop resistance. So we're looking, once again, if you go to a conventional oncologist, there might be some of this cookie cutter kind of protocol when it comes to a diagnosis like this. I want to get into this a little bit deeper, talk about individualized care and some other options when this diagnosis has been handed to you. All right. So what are some of the other things that affect breast cancer? Well, the use of nonsteroidal anti-inflammatory devices. So we're talking about ibuprofen and things like that. So researchers found that a 21% decrease in breast cancer risk in women who took 2 of the anti-inflammatory medications, aspirin or ibuprofen, a week. Inflammation causes damage to breast cells, making cancer develop more likely. But NSAIDs cause stomach ulcers, among other adverse effects. So I definitely, even though this is in the research, taking NSAIDs is not it'll never fall out of my mouth as far as a recommendation for prevent breast cancer. We've got other, I think, effective, natural, clinically studied ingredients to do this, to not only treat when we're talking about cancer diagnosis, but also prevent, and we're going to get into that, okay? Frequent use of antibiotics affects breast cancer risk. Women who used antibiotics for more than 500 days or had more than 25 prescriptions in a 17-year period had doubled the risk of breast cancer as women who didn't use antibiotics. And I can tell you that has a direct effect to the disruption in our microbiome and our immune system, because where does our immune system mostly hang out? It is in our gut. And when you take those antibiotics that are obliterating our good bacteria, this is where you're going to increase that risk factor there. And then, of course, high levels of inflammation. There's a 2015 study that found that women with high levels of the inflammatory marker C-reactive protein are twice as likely to develop breast cancer than women with low C-reactive protein. And so that's an inflammatory marker. It's used a lot with cardiovascular, but it's actually, it can pick up systemic inflammation as well. So very important to take a look at. All right. So let's get into the good stuff after all that, natural interventions for breast cancer. So first of all, I'm not going to spend a lot of time slide-wise on diet, but when it comes to, as my lovely patient that I just referenced, she cleaned up her diet like that and was on par. But you want to think about color, okay? You want to think about clean. You want to think about avoiding exposure. You want to think about organic, leafy greens, cruciferous vegetables, berries, bright orange color fruits and vegetables, nuts and seeds. The colors will give you the antioxidants, the polyphenols. Those are extremely important. There's a tremendous amount of research on a macrobiotic diet and creating more of an alkaline environment when a diagnosis of cancer has been rendered. But diet is extremely important. One of the things that I also encourage folks to do, there's a great nonprofit website called EWG.org. That's environmentalworkinggroup.org. And they have the list of the Clean 15 Dirty Dozen, and they've got a cosmetic database and sunscreen options. But they are my go-to place for helping reduce exposure to these harmful xenoestrogens in the environment, okay? And so the Clean 15 Dirty Dozen, Clean 15 is, hey, if it's not organic, okay, but regarding the pesticide absorption of the Dirty Dozen, those are things that you must get organic and really, really watch out for there, okay? So I think diet and staying hydrated and increasing detoxification across the board is extremely important. And like I said, not what I'm going to dive in deep here to, but it's certainly something that I wanted to mention. All right. So let's talk about our first natural intervention. This is, I could talk, and I have talked, there's a Terry Talk Nutrition about curcumin for hours on this lovely ingredient because it has so many positive medicinal benefits. So curcumin is the active compound from turmeric, all right? It has the ability to neutralize cancer-causing free radicals. One of its, many, many modalities is that it's anti-inflammatory. It stops cancer cell formation, the replication of it, and also the spread of it. It keeps the liver healthy, tons of different clinical studies regarding liver health and curcumin. And the liver is really important. You're like, well, why are we talking about the liver? This is breast cancer we're talking about, right? Well, 80% breast cancer, right, estrogen receptor positive. As I said, your body looks at estrogen as a toxin, and it has to be detoxified through the liver, cytochrome P450 pathways, all that good stuff, both phase 1 and phase 2. So liver health has everything to do with breast cancer. So keeping your liver healthy definitely has a benefit on the effect of estrogen synthesis and metabolism. Okay, so very important to understand. Let's get into some of the specifics regarding curcumin. So this was a particular study that shows curcumin stopping breast cancer cell replication. That's huge, okay, that we can have this. This is a mouse model of estrogen receptor negative human breast cancers. The control you see there versus high and low dose curcumin. The high-dose curcumin increased the rate of breast cancer cell death. And dosage in curcumin is extremely important, and I want to be as specific as I can here because I have, one of the things that I ask folks to do when they come into my practice is bring all their supplements in that they're taking, okay, anything that they have and that they're taking. And you can imagine that I've seen it all. And I shake my head sometimes like, where did this come from? Because there are different qualities of natural supplements for sure, just like anything else. When I'm looking at, as a consultant in the natural product industry, what I'm looking for is not just a label claim, okay, where it says something and there's this fantastic claim on the, advertisement that you saw it on or on the bottle that there is, but that it's actually been cited in clinical studies and there's going to be a body claim, okay? It's going to have an effect on the body. We're going to be able to deliver a functional dose. And I don't think I've ever seen a more dose-dependent botanical medicine than curcumin, okay, or turmeric. And once again, we're going to talk about this a little bit more, but curcumin is the active ingredient there in turmeric. And so the dosing is very, very important. If I just, if I see somebody going down to their regular drugstore and grabbing a, $2.99 bottle of turmeric, I know that they're probably not getting the benefit from what they could be getting if we were following the studies and following the dosage recommendation from those studies where these are proven to have this effect. And when we can say that curcumin stops breast cancer cell replication, I don't want to just say that and then have people just running out to get any old curcumin. This is very, very specific at a particular dose. All right, so I think very important to understand because I've seen this happen in my career over and over again where we'll have incredible just evidence about a great botanical medicine, clinically studied, evidence-based, botanical medicine, and it gets out to the public and the consumer, and then it's marketed, and the marketing process is skewed by manufacturers that aren't doing a good job on behalf of the consumer, and then the supplement doesn't work, and I get a little bit upset about that because then I feel like people go back to conventional treatments and medications that have devastating side effects because they aren't getting help. So this is a really important piece for me, and I want people to understand that. All right, so I just want you to know there is going to be somewhat of a graphic image on our next slide, so just take a deep breath. But I think it's really important that we see, I think this is this depicts the way that curcumin can slow the growth of breast cancer tumors. Okay, so when I was putting myself through nursing school, I worked in as a phlebotomist, and that was so phlebotomy is the drawing of blood. So at St. Mary's Hospital in Grand Rapids, Michigan, and I did some time in the pathology lab. So I got to see these tumors that came out, and I hooked up with a pathologist, and I just thought the histology of tissues, the story of these tissues is extremely important. It gives us information, right? So, but this is, think of the option one, this is on the left here. This is a mouse model of a human breast cancer. And so you see the control on the left side, and then you see curcumin being on board, and it has reduced the size of the tumor to almost 50%. And I just think that that is really important for you all to see. So I apologize if that is too graphic, but it is about half the size, okay? And that's what we want to do. Even if there's going to be a lumpectomy, even if there's going to be chemotherapy or radiation on board, the more we can do to actually take a hold and shrink that tumor, your outcome is going to be so much better if you choose conventional treatment modalities. So these things can, another thing that I want to make sure to mention is these things can be used and should be used in conjunction. It doesn't have to be either or, and that's certainly not what I'm saying here, okay? So again, curcumin, estrogen, and the liver. So curcumin reduces estradiol. That's E2, or there's E1, which is estriol, E2, which is estradiol, E1 is estrone, E2 is estradiol, and estriol is E3. So we've got three different, or there's a family of estrogens. And so it reduces E2 production, and one study reported that there was a 22% reduction in estradiol. So if you've got a estrogen-sensitive tissue going on, then this is really important. It also blocks the estrogen mimickers, these xenoestrogens from the environment. So think about it. We're talking about plastics and pesticides and car exhaust and soaps and emulsifiers and household cleaning products and health and beauty aids and, you name it. They're everywhere, and this is really important. There's a study that I found that 98% reversal of breast cancer induced by exposure to a known xenoestrogen. Also in the liver, so we're talking hand in hand again once here. Estrogens are broken down and expelled from the body through the liver, and curcumin increases the liver's function while protecting it from exposure to potentially harmful compounds, including the xenoestrogen. So it's hepatoprotective. So big bang for your buck with curcumin here. All right, so once again, big facts about curcumin. This is turmeric, as you see right there. That is the lovely food, okay? It's a spice. It's been used for thousands of years medicinally in foods and in drinks and things. The curcumin is the powdered extract from turmeric. This is the medicine. That's what we want to think about, It's really important because, if you go back into sort of the history of turmeric and when it started to understand how medicinal it was, those curcuminoids are poorly absorbed into our bloodstream. And so you want an absorption agent to get those curcuminoids into the bloodstream so we deliver that effective clinically studied dose, okay? So blended with turmeric essential oils is one option, and it's preferable definitely to turmeric or plain curcumin extract. So you want to be able to look for the enhanced absorption curcumin. And then also, when you're reading the labels of a curcumin that you're actually purchasing and getting, you want to be able to understand that most of the clinical trials have used dosages in the range of 500 to 1,000 milligrams of the curcumin. So I want you to see that on the label it needs to say not just this is how much there is in there, okay? Because sometimes that's blended with the absorption agent, sometimes that's blended with just the straight turmeric. I want you to be able to look for the curcuminoids, okay? How much of the curcuminoids is there? That's what I want you to be able to effectively see from that label. I think that's a really important point. All right, another very natural, intervention, vitamin D. So vitamin D, the liquid sunshine, we can say. It's a sunshine vitamin. But, actually, it's a pro-hormone. Vitamin D is actually kind of a hormone. More about that in probably another Carrie Talks because I know, why do we call it a vitamin when it is pro-hormone? We can get into that. But one of the things you need to know regarding vitamin D in cancer, it's extremely, extremely important, okay? Your skin is exposed to sunshine, and it can make, with healthy liver, with healthy kidneys, vitamin D. It is important for bones the immune system, and so much more. It's got several anti-cancer activities. It decreases cancer cell growth. It increases rates of cancer cell death. It reduces formation of blood vessels that feed the tumors, that angiogenesis that I was talking about. A recent study found that taking a basic multivitamin lowers breast cancer risk by 30%, and that's adding 2,000 IUs of vitamin D every day. That will cut breast cancer risk by 50%. Now, another thing about vitamin D receptors, they're all throughout your body. They're in your brain, your thyroid, your adipose tissue. I do believe that getting tested for vitamin D levels is extremely important these days. And you've got that really wide range, that 30 to 100, let's say. And actually, this range was designed to just specifically analyze vitamin D levels in association with osteoporosis, not all the other things that vitamin D helps, okay? When I'm looking at this range, I have people basically coming in at 31 or maybe 32, and it's like one click above rickets, and I'm like, that is not optimal, and that is not what we're looking for. There was a study that came out, the National Institute for Health, in 2010. 4,000 IUs is the minimal dose for infants, okay? So people worry about taking too much vitamin D because it's a fat-soluble vitamin. I totally understand. But I got to tell you, we need to recover our vitamin Ds into what's optimal. So basically, if you look at that range of 30 to 100, and I want a bullseye, okay? I want right in the middle, so I'm looking anywhere from 60 to 80. That's where I've seen optimal thyroid function, immune health, etc. So take that vitamin D, get it up to more optimal ranges. I think that's extremely important. Because vitamin D is associated with breast cancer survival. We've got 469 breast cancer patients here treated surgically. Serum vitamin D levels were measured before surgery and annually thereafter. Especially for women with advanced cancer, adequate vitamin D levels were associated with greater post-diagnosis survival than low vitamin D levels. So obviously, when you get a diagnosis of cancer, it is a process because you go through investigation of what kind of cancer, what are we going to do about it, what's the treatment, and then there is, hey, what's happening afterwards? Because the number one risk factor for getting cancer is already having had cancer. So these are the things that we really, really, really need to take into account here, okay? So vitamin D, we want to be looking at optimal levels, not just one click above rickets. A little bit more about vitamin D here. There are two forms, so you might, vitamin D3, that's the human form, the cholecalciferol, and then from fungi, D2, that's the plant form. I can tell you a quick joke here. I'll have to answer myself because I can't hear any of you, but why was the mushroom invited to the party? Answer, because he was a fungi. Why was he asked to leave? Because there wasn't mushroom. Okay. You can keep that, tell it, post it, just a little bit of humor right there. Laughter probably is cited somewhere in the literature for cancer prevention for sure. Increases our anti-inflammatory cytokines and all that good stuff. Okay, back to vitamin D. So the D3 is generally the preferred form, okay, up to 3 times more potent than D2. It's more stable, greater ability to bind to vitamin D receptors. So you're looking for D3, I would say. And then, like I said, to get my patients recovered from low numbers of vitamin D, I have no problem, quite honestly. Me, 10,000 IUs daily for 2 weeks, and I drop them down to 5,000. We go at it for at least 3 months, and then we taper off into a multivitamin and make sure that they increase their ability to get vitamin D through their diet and also get out in the sun. And a lot of times the risk and the prevention of skin cancer can inhibit that, or anything that is protecting our skin from sun is going to inhibit that process. And so collectively that all makes a big difference in what's going on. All right, so we've got curcumin, we've got vitamin D. Going on to one of my favorite fruits ever, the pomegranate. So fruit from the pomegranate tree, rich in powerful compounds. It's actually omega-5. So it's a couple things. Polyphenols, you can just see this. You can just see the color as I talk about diet. Those bright colors. Anti-aromatase activity. What's aromatase? Well, aromatase is an enzyme that increases estrogen formation. It basically takes our androgens, which are kind of known as more male hormones, we have them, DHEA, testosterone, and they form it into estrogen. And so it's just another source that you can get if you've got increased aromatase activity. And so anti-aromatase activity in a natural form is really important because there are synthetic aromatase inhibitors out there. Lots of side effects: joint muscle pain, risk of bone fractures, menopause-like symptoms like hot flashes, night sweats, and vaginal dryness, okay? So pomegranate is amazing for this. It's anti-inflammatory, it's an antioxidant, and it increases cancer cell deaths and stops the spread of cancer, okay? So another natural intervention where we can actually get this job done. So here, the blue column here, 100%, this is a control group, okay? So this is in vitro testing of human breast cancer cells. The red is 100 micrograms per milliliter, that's a dosage, of pomegranate extract. The green is 500, okay, micrograms per, and then the purple is the paclitaxel. Paclitaxel is a chemotherapeutic agent, okay? 80% inhibition of breast cancer cell proliferation without the side effects. Pretty darn amazing that this in vitro study was, showing you how effective pomegranate extract is. Also, just a depiction of it inhibiting that aromatase activity, up to 60% inhibition of aromatase in breast cancer cells when exposed to different compounds from the pomegranate seed, okay? Really, really important. Also, pomegranate has the ability to increase the effectiveness of tamoxifen. We talked about tamoxifen resistance that can happen. Pomegranate alone had significant inhibitory effects, which was nearly doubled when combined with tamoxifen. So it decreases that resistance of tamoxifen, and you can actually use a lower dose perhaps and not get so many of the side effects. So you see there the control group with the inhibitory effect. You've got tamoxifen on board, then you've got the pomegranate and the tamoxifen right there, the purple with the pomegranate. Very, very, very compelling. So a couple things to know about this lovely natural ingredient when we're talking about breast cancer. It's an omega-5. The punic acid is found only in the oil from the seed. I think one of the the most difficult things about eating a pomegranate is getting to those seeds. I think, YouTubed several times how in the heck can I easily, without staining all of my clothes, get these lovely medicinal seeds out of there. Taking it in an extract definitely cures that. Pomegranate fruit extract also has beneficial anti-cancer compounds called polyphenols. We're looking for that deep, deep red color, so back to the diet and what you want to actually intake when this is all going on. And so look for a combination of fruit extract and the seed oil for best benefit. So once again, you can get this in a natural supplement with the fruit extract intact, as well the oil, that omega-5, right? So omega-3 is omega-6 is not the only oils. We've got omega-7s, omega-9s, omega-5s. And here we've got that omega-5 that actually has so many benefits when it comes to breast cancer diagnosis. All right, moving right along. Let's talk about grapeseed extract. Once again, what are you seeing a combination here? Like, I mean, vitamin D, obviously we didn't see much of a color except that bright yellow liquid sunshine. With the curcumin, you've got that bright orange, right? With the pomegranate, you've got that bright red. With our grapeseed extracts, you've got that deep, deep, deep purple color. So those colors are the things that we are so wanting to get in, whether it's taking a natural supplement or definitely getting those in your solid, clean, organic diet. But the grapeseed extract, powerful antioxidant, once again, stronger than vitamin C and E. Regarding breast cancer, here's the modes of action. Aromatase inhibitor, we talked about that. Cytotoxic, so it has the ability to kill those dividing cells. Reduces the ability of tumors to form blood vessels, that anti-angiogenic, because that's kind of what our body just basically wants to do. Our brain is like, oh, got to get that circulation, got to get that oxygen into that new tissue that's growing. And then it has been shown to stop the breast cancer cell from spreading. So here we have it. This is inhibiting aromatase. You've got aromatase activity here on the left-hand side, the control group. And then the red, we've got breast cancer cells exposed to increased doses of grapeseed extract. You've got the more 70% reduction in aromatase activity with the higher the grapeseed extract. So the more grapeseed extract, the better the inhibition of aromatase activity. Grapeseed extract also kills breast cancer cells. So here we've got human breast cancer cells exposed to grapeseed extracts. That's 50 milligrams per liter. Got your control group, and then 47% inhibition of cancer cells after 72 hours. Same study showed that grapeseed extract had no effect on normal gastrointestinal and immune cells. That's really, really important, because a lot of times that's where we start getting into trouble when we are choosing conventional cancer treatments. It's the side effect of the chemotherapy that are not only stopping the dividing cells that we wanted to stop, but it's also stopping other cells that we actually need. So because we need our GI cells there, because nutrients are so important. As you can see, getting these nutrients on board into our cells, into our system, extremely important in treatment and cancer prevention. And so we don't want those. And so this same study, once again, no effect on the cells that we don't want to have to be stopping dividing, okay? All right, a couple things we want to know about grapeseed extract. So those proanthocyanins, once again, it's the color. Beneficial compounds in grape seeds are really, it's all about, it's the color, and these are the seeds actually, okay? The oligomeric proanthocyanins, small and easily absorbed. Grapeseed extracts that are high in tannins are actually poorly absorbed and won't have the same benefits. So what I want you to look for is the French grapeseed standardized to OPCs and the tannin-free. The OPCs are the oligomeric proanthocyanins. So you want them tannin-free, and you want to look for the French grapeseed. All right, they're the smaller ones that are easily absorbed, because once again, I want to be able to get you to, when you're taking these things and we're learning about them, not just a label claim, not just something that is the cheapest on the, the page that you're looking on or at the store. It's the very specific kinds that are going to deliver the medicinal promise from the studies, and also going to deliver that functional dose. Very, very important to me. So final thoughts. The wholeness thing. Gladys McGarry is an MD. She's 92 years old. She's basically known as the grandmother, I guess, at this point in time, of holistic medicine. She actually started the American Holistic Medical Association because when she was in her first years of practice, way back when, she wanted to be doing things differently than sort of reductionistic, the reductionistic way of looking at things. And there wasn't anything out there, so she and a couple colleagues, they said, well, let's just begin something. And I heard a lecture of hers recently. She's still got everything going on, and she's like, I think I've heard enough about wellness. She's like, I think it's about wholeness. And one of the things, and I'm paraphrasing here, that she went on to say is, she has seen many, many people with no specific illness, diagnosis, that are not very whole, that are not very well. But then she can also see somebody who's been delivered a devastating diagnosis, who might still be, living and have this diagnosis, and they still be dealing with it, that are extremely whole. So her whole thing was about more wholeness. Can we have intact our good physical body, our choices, our thoughts, our mind, body, spirit, the way that we engage socially, the way that we have a relationship with ourselves, no matter what's going on. Because like I said at the top of this lecture, pretty big, the C word, definitely connotated. But we've got, when we look at it, like I go back and we just look at that uncontrolled division of abnormal cells. We look at perhaps a disruption in our genetic integrity and immune surveillance, and what can we do to identify and treat the cause? What can we learn from it? Where's the opportunities here? What has our diet been like? Where can we ask better questions? Maybe the breast cancer answers is just us being able to simply ask these better questions, knowing that there's more out there than just what has been largely in play, the conventional Western treatments for cancer. And of course, it's an individual decision. A lot of times it's my job as a practitioner and even as an advocate for folks is just to get them and help you be completely informed, not to have some sort of, right or wrong, because there's no right or wrong. Everybody's individual. This decision is individual for everybody as far as how people progress through getting a diagnosis like this. Being gentle and slowing down and getting informed, I think, is really important, but also understanding that natural interventions for breast cancer are there. We talked about curcumin. We talked about vitamin D, talked about pomegranate, grapeseed extract, and the specifics about all of these things. Really, really important research. And so with that, I think I'm going to end there and open it up for questions.
Well, thank you so much, Dr. Lucille. Every time I hear you speak, I learn something new, and it is very inspiring to know that whatever the diagnosis, and no matter how devastating the diagnosis, there are still interventions that can help people achieve better wholeness. So thank you so much. I do want to point out to folks that you can find Dr. Holly Lucille on the web at www.drhollylucille.com. So thank you again, Dr. Lucille.
Yeah, my pleasure.
You can also follow Dr. Holly Lucille on Facebook at facebook.com/Dr. Holly Lucille, all one word. So thanks, everybody. So let's move into some questions. I know that we have some that have already accumulated. So let's see. Here we've got one that wants to know, how do you protect healthy cells during chemotherapy and radiation therapy?
Yeah, so once again, I think that, first of all, I need to be very specific here. And, I promise, folks, I wanted to give you, it's ONC-ANP is the www .onc, so it's short for oncology, ONC-ANP, so the Association of Naturopathic Oncologists.org. So it's ONCANP.org. Well, first, I think what I can say to this question is that that can happen, and I think that's the beauty of, and it's truly the integrative approach. And I think also I'm just going to take this opportunity to talk about what integrative really means. It's not natural versus conventional or synthetic. It's not, I don't think. I think that sometimes an integrative approach, even though this is off subject, is a hip replacement. That's an integrative approach into perhaps the way somebody has been doing everything else. We're going to integrate that into the mix because that's what's needed, okay? We can make those decisions based on treating the whole person and really looking at it. And so when it comes to the integrative approach, if you are having chemotherapy and radiation, there are different chemotherapeutic, and there are radioprotective things, and there are certainly chemoprotective natural supplements out there. I am going to encourage each and every person with this question to actually, I would get with a practitioner that understands, because there are some contraindications. Now, a lot of times what I see and hear from conventional docs is just stop taking everything because they don't know. They don't know some of the natural approaches and some of the natural ingredients, what interacts with some of the chemotherapeutic agents. And so it's the blanket statement is stop taking everything. That is not the greatest approach, in my opinion. I think you should get with a specialist that knows the type of chemotherapeutic plan that you're on or the type of radiation, and get very specific, because a blanket statement from me is not going to do anybody any good, because I could, first of all, put you at risk of doing harm, and also you want to know specific dosages. And so that's when you want to get a second opinion or get another person on your team, like a naturopathic oncologist. I think that's extremely important.
Excellent. We have another question about a woman whose sister was diagnosed with DCIS, ductal carcinoma in situ. Her case was mild, but her stress was unbelievable. Do you have any suggestions for dealing with cancer anxiety?
Well, yeah, I mean, we went through very specific things today, but I sort of started with the diet, but the stress. Look, this is we are rarely in true danger anymore, right? We rarely have a bear running after us. We are just rarely do we have true danger that gets that fight, flight, freeze thing initiated. It's the cumulative, compounded, confounded stresses of our modern day, and then having this diagnosis is extremely stressful for people, because there's a tremendous amount of fear involved, And there's a tremendous amount of taking responsibility and also making decisions. My best advice is, first of all, to work with somebody, because I want people to get on some adaptogens. Those are botanical medicines that actually can help you adapt to the different physical stressors, emotional stressors, intellectual stressors that are going on at this point in time. But once again, you want to do that safely and you want to do that appropriately with clinically studied medicines. And the other thing is to slow down and know that this is an important piece of treatment because stress increases cortisol, which is a very inflammatory hormone, and it contributes to the continued problem. And so the awareness is everything. And being able to, once again, take this as an opportunity. I say get curious before critical. A lot of people, you know, like, I hate cancer, or F cancer, and all that stuff I see out there. I understand, but I think maybe an approach that we would want to consider is, how in the heck did this happen? What can I do about it? Anything that you can subtly do to start to empower yourself. You know, because we're the host. You know, it's almost like when we get a cold, I talk about increasing the resistance of the host. You know, that's trying to understand that, you know, I hear people all the time go, oh, my husband gave me a cold, right? I'm like, well, it doesn't really work that way. Because we have this incredible immune system that can, you know, fight off invaders, and it just doesn't really work that way. We have to take some responsibility, and I say that really cautiously because I don't want to blame anybody for getting cancer. That's not what I'm saying. It's that we have the opportunity to look at our resources, to slow down, it's one thing to certainly have fear initiated because of the diagnosis, but it's another thing to just sort of have that spread like wildfire. We don't want that. So being able to slow down and slow down enough to use your mind and start really taking in the information. And, you know, be protective of yourself. I know that there's many situations when there's a lot of people that care about you, and they're going to tell you what they want they want you to do, and everybody has an opinion. And so having boundaries and being able to talk to folks that you want just to listen and tell people what you need.
Excellent. Somebody asked for some examples of adaptogens, so I would say, well, for example, there are studies on KSM-66 ashwagandha for stress and for adaptation, and Rhodiola, rhodiola. Are there other adaptogens that you like?
Sure. I mean, like holy basil is lovely. As you said, ashwagandha, rhodiola, they're some of my favorites.
That's awesome. Here's another question that's come through, wondering, they say, if a family member has the gene, so I'm wondering if they mean BRCA, BRCA, would you recommend, as doctors do, a complete mastectomy, double mastectomy?
You know, so once again, I'm really, I'm gonna continue to just say this. Every case is individual. I think this is a decision that needs to be made with you and your healthcare practitioner. If it was me, I will tell you that I would not do that. I think that I don't think that is needed across the board. But there are different things that contribute to that decision, and it all really depends on a lot more information that I would want to get from the patient than besides just the fact that they're positive for that gene. But no, it's not my recommendation across the board that happens. There are people that choose that because they don't want to deal with it. They think the risk-benefit ratio the risk is there, and it's not something that they want to deal with, and so they decrease the risk by perhaps just taking out that tissue there. But I don't think that that's a blanket recommendation for me for folks with that gene. No.
Excellent. All right. Let me look through here, make sure I haven't missed anything. A question about are any of the herbs that you talked about today, have they been co-studied with chemotherapy? I know for sure that curcumin has published studies looking at its use alongside certain types of chemotherapeutic interventions.
100%, yep.
Yeah.
Yeah, and that's why, yes. So the answer to that question is yes, and that's why, I mean, I think this knowledge in getting this understanding that there are other interventions out there is really important, but specifically being able to partner with somebody who's going to understand the chemotherapeutic agent and also dosage, and it's just so vitally important. And it's just, I think what I've seen is that there's you get confidence, in somebody who this is their wheelhouse, and this is what they do day in and day out. And I think that's really helpful for the soul when you've got somebody like that on your team.
I believe there was a study a couple of years back. I think it was more than 5 years ago. But I always remembered it because it was survival rates of women with breast cancer after treatment, determined by whether or not they joined a breast cancer support group or not.
Right.
And it found that there was a significantly enhanced survival in women who joined a breast support group or a breast cancer support group, and they didn't know if it was because of the emotional stress or emotional support, the stress reduction of being able to talk with people who had had similar experiences, or even the sharing of best practices. This worked for me, this did not work for me. But whatever the case may be, if you're so inclined and if you are struggling with the disease, that's something to keep in mind, is that there are resources out there that might make a real difference in helping you achieve your most optimal level of health.
Such a great point. It's such a great point. When you think about detoxification, I think about opening the emunctories, and you think about, well, that's perspiration and respiration and defecation, but emoting is a huge way to, have you ever just come home and wanted to vent? You just need to vent. It's healthy. Contained venting, with safe people. It's a way of getting things out that you don't want stored in those tissues. And I think I'm not surprised at the results of that particular test, that's for sure.